Lynn, and good morning and welcome everyone to Vaccine 101, an information session for businesses and workplaces. My name is Su-Ling Ching. It's my honor to be the President and CEO of the Ottawa Board of Trade. I'd like to take this opportunity to thank Ottawa Public Health, OCOBIA, and RGA, who have collaborated with us over this last year to make sure that we're bringing our business community the latest information and guidance on various topics related to COVID-19 and in preparation for the reopening of our recovery. Before we get started today, I would like to share one announcement. Hopefully you have already heard that the Ottawa Board of Trade has partnered with the Canadian and the Ontario Chambers of Commerce, as well as the provincial and the federal government, to deliver the rapid screening test kits to businesses in Ottawa. So we will be doing this in order to help businesses identify asymptomatic carriers of the virus. What we know is that 1/3 of all infections are asymptomatic, and that 55% of confirmed cases are receiving the virus from an asymptomatic carrier. So we feel as though this is an extra layer of protection for our businesses, along with all of the protocols from OPH, including PPE, screening, and making sure that you're doing physical distancing. With our local partners at Invest Ottawa and Bayview Yards, we are getting ready to set up a site to directly distribute these testing kits to businesses with 150 employees or less. And we anticipate the site will be ready to go on May the 26th at 10 a.m. For more information about this program or to find out what other size businesses can do in order to access these test kits directly from the government, please visit our website at ottawabot.ca or email us at strongertogether@ottawabot.ca. Also, we'll be hosting an info session, a very brief info session on May 19th at 3:30 to answer any other questions, and I think Lynn is going to share that with us in the chat. We invite you to register for the next business reopening workshop on May 27th at 1 p.m. And this again is in partnership with our friends at OPH, OCOBIA, and RGA. And this workshop will focus on reopening slowly and safely, lessons learned, safety plans, public health and measures guidance, and an opportunity for a Q&A. The Ottawa Board of Trade is committed to connecting you to the information you need, to inspiring you with expert speakers. And to this end, we invite you to join us at some upcoming events. On May 20th at 4 p.m., we will be hosting our fastest growing companies event to celebrate some local success stories over this past year of challenge and change. On May 27th, we're hosting our Women, Wine, and Wisdom event, and the theme of this one is Staying Strong. So this is an event that has been very well attended in person in the past. This is our attempt at doing the virtual version, and we're really looking forward to hearing from some fabulous women leaders in Ottawa to share their stories of how they have managed this last year and how we can move together forward for gender equality. And then on May 28th at 7:30 a.m. is our monthly Mayor's Breakfast. This month, we will be speaking with Michael Crockett, who's the President and CEO of Ottawa Tourism. As we know, tourism is a key economic driver in Ottawa and has been one of the hardest hit sectors during this last year. So we'll hear about what Ottawa Tourism is planning for us in order to rebound and hear from a few of our tourism operators about what they have done during this last year. It is now my pleasure to introduce Michelle Grew, the Executive Director of the Ottawa Coalition of Business Improvement Areas. And thank you again, Michelle, for your partnership on this. I turn it over to you.
Thank you so much, Su-Ling. And thanks to Ottawa Public Health for hosting and providing all of this information for our business communities. And, you know, we're very much looking forward to this. It's always a step in the right direction. And if you are more comfortable attending these events in French, RGA is hosting the French version of this presentation tomorrow. You can go to rga.ca to register for the event. As Suling mentioned, as we look forward to our reopening, there will be a reopening workshop next week on May 27th, and you can register for that on the Ottawa Board of Trade website. So thank you once again, and I would like to turn it over to Chantal De Laplante and Jennifer Maybank. Thank you so much for providing this information.
Thank you, Michelle. Morning, everybody. Thanks for joining us this morning. I'm one of the team members on the Business and Workplace Engagement team at Ottawa Public Health. And the team and I put together this presentation today for twofold. So first is to give you information on vaccination, all things vaccine, so that you could share it with your employees. And then also to give you some tips and tools and guidance on how to have those potentially difficult conversations about vaccines with your employees. So we'll jump right in. So just a little disclaimer, since this is a recorded presentation, if the recording gets shared out, I just want people to know that the information here was last updated yesterday on May 17th. And for the latest information, you can consult our webpage, ottawapublichealth.ca/COVID-19. I'd like to begin today's presentation by honoring the Algonquin Anishinaabe people on whose traditional unceded territory the City of Ottawa is located. I extend this respect to all First Nation, Inuit, and Métis peoples, their elders, their ancestors, and their valuable past and present contributions to this land. So as I mentioned earlier, the goals for today's presentation are first to share information about the Ottawa vaccination plan as it pertains to workplaces and essential workers. And then two, to give practical tips to build vaccine confidence among employees. So today's presentation will cover the Ottawa vaccination plan, the logistical details of how, when, and where to get vaccinated, how you can support your employees, what to expect when and after getting vaccinated with regards to returning to work, side effects and symptoms, etc. And then we will take you through a new webpage that we have available for workplaces and employers. It's our COVID-19 vaccine toolkit for your sector. And then we'll open it up at the end for a Q&A. So we'll jump right in. So over the last 2 weeks, all essential workers that cannot work from home, aged 18 plus, were eligible to book their vaccine appointments. So I hope that many of you and people in your organization and your members and your employees have had the chance to book their vaccine appointments if you were eligible already by age or by group of essential worker. Starting today, good news, everyone aged 18 plus, regardless of essential worker status, is eligible to book their vaccine appointment. So this also includes people who are 17 years old, but who are turning 18 in 2021. The province also plans to expand eligibility to youth who are between 12 and 17 years of age during the week of May 31st. So more details on that to come closer to the date. And I encourage you all to register for our city COVID-19 vaccine newsletter or to the community operation newsletter as well. And we share the latest details there as they come up, so you can have the latest on eligibility, how to book, where to go, etc. So for now, if you or your employees are eligible, you can go online at ontario.ca/book vaccine to book your COVID-19 vaccine appointment. So this is great news because it brings us that much closer to achieving herd immunity and to be able to start slowly reopening things. So for essential workers who live out of province, We're very close to Quebec, so a lot of people may live in Gatineau or further in Quebec, but they work in Ontario. So if they do work in Ontario, they can make their vaccine appointment here in Ottawa. I would encourage them to make their appointment either here or in Quebec, wherever they could get the first vaccine appointment for them. And they can do that by phone. So they have to call Ottawa Public Health to book that. The number is here on the slide. It's 613-691-5505. And this is for essential workers who cannot work from home that are listed in Group 1 or Group 2 by the province. And we can put the link to the full list of essential workers in the chat for those of you who are curious to check out the full extensive list. It includes volunteers, learners, and people who work part-time. It does not include people who work primarily from home or who have the ability to work remotely. And we're not asking anyone for written proof of their essential worker status. It's just going to be something that they confirm over the phone verbally. So these next two slides outlines the Group 1 and Group 2 essential workers who would be eligible to get vaccinated in Ottawa, even though they might reside in Quebec. So I'll skip over these fairly quickly, but my colleague Kyle will put the link to the full list of eligible essential workers in the chat if you want to consult it for more information. So now for booking your appointment. After you confirm that you're eligible, you can, which is everyone now 18 plus, you can go to the province's webpage and you have a few different booking options. So from there, the first option, and probably the one that most people are going to rely on, it's pretty straightforward, is to book through the provincial portal. So this option is available online or by phone. So if you call by phone, the service is available in multiple different languages other than French and English. And I believe it's also available in sign language in ASL and LSQ. However, if people are not able to navigate the web, or if they have some specific accessibility requests, they can call Ottawa Public Health at our booking line, 691-5505, and they can book with Ottawa Public Health. So specifically, people can call OPH if they don't have an OHIP card. So people who may be temporary workers here in Ontario, or people who are perhaps newcomers to Canada who don't yet have that piece of documentation, people who are Indigenous, if people are homeless, if people can't use or access the internet, and also Quebec residents who are working in Ontario. Those are all the folks who can call OPH, and then we'll be able to book you through. There's also another booking option, which is to make an appointment through a pharmacy. So the list of participating pharmacies is available on the province's website, and the pharmacies are now offering Moderna or Pfizer. You have to book, from what I understand, with each individual pharmacy, unless it's like one of the big ones like Shoppers Drug Mart or Rexall with multiple different branches. Then you, I think, book through like Shoppers Drug Mart, and then they'll give you a heads up when there's vaccines available at all of their sites that are near you. So you can look at those. And if your primary care physician is also doing vaccinations, then you could, they may reach out to you, or you may reach out to them and make your appointment that way. But I think the most straightforward one is through the provincial portal. So one thing of interest for you as employers is the option to make an appointment for someone else. So if you're aware of some staff who just maybe need a little bit extra support, perhaps they can't navigate the web, perhaps they don't have access to the internet at home, or they have other barriers to booking their own appointment, you can definitely do that for them. All you need is verbal consent. You don't need written proof or anything like that. And then you'll have to collect their personal contact information. So if they have a health card, you'll get that from them, their birthday, their postal code, their name, and their phone number. And then you can register them online or by phone, and it's very simple. Then you just share the appointment details with that individual. And while you're at it, you can check in with them to see if they need transportation assistance to get to their appointment. And there's a free transportation service that I'll present to you on the next slide as well. So for getting to the clinic, this is definitely a barrier that some people experience is transportation. So the first option that we're encouraging people to explore is whether they can make a plan with family, with friends, if there's an OC Transpo route that is available to them, or if they're already a registered paratranspo user. Those are all, that's like the first line of options for people to explore. However, if none of those options are available, Ottawa has a slew of volunteers who are giving this transportation service free of charge. So all people need to do is to wear a mask in the car, and the drivers, the volunteers are all following COVID protocols, so things are pretty safe. And to set up that service, people can call 211. All they'll need is their vaccine appointment booking number. And we just ask people to give us 48 hours notice in order to line up the volunteers and get that process started. If people are recipients of social assistance, they can also contact their caseworkers for help with transportation costs if needed. So there's a couple of different options there. Yeah, so the next big question is, that covers the logistics of how to book, where to go, getting to the clinics. Now, the next big question you might incur is, are the vaccines safe? So as an employer, you play a really important role in sharing evidence-based information with your employees. And the next couple of slides are for you to be able to have some information to give evidence-based information to people to help them make an informed decision. So are the vaccines safe? As of May 17th, there have been nearly 1.5 billion vaccines given out around the world. The majority of these are Pfizer and Moderna, although many of them have also been the Janssen vaccine and AstraZeneca. Those are the main ones that are being distributed. And the real world data continues to support the use of the COVID-19 vaccines. So all approved vaccines are safe and effective at preventing you from getting seriously sick and dying from COVID-19. None of the vaccines are made of a live virus, and they cannot make you sick with COVID-19. We've received some questions from the community recently as well of whether or not the vaccine can alter someone's DNA. And the answer is no, the mRNA vaccine and the viral vector vaccines do not alter someone's DNA. We have a whole section on our webpage with frequently asked questions that you can consult if you are hearing some common themes. You can check out our webpage, and we likely have an FAQ there as well. So we can't talk about vaccine safety without touching on AstraZeneca. So as of May 11th, so last week, the province paused the first doses of the AstraZeneca vaccine. So before this decision was made, the risks of a severe outcome from COVID-19 were much higher than the risk of having a blood clot from the AstraZeneca vaccine. But now the rates of COVID-19 are starting to decrease. So the one indicator is going in this direction, and then the rates of the risk of having a blood clot and a severe outcome with AstraZeneca have actually increased. So in light of this, the fact that the two indicators, like cases are going down and the risk of AstraZeneca was higher than originally anticipated, the province made the decision to pause AstraZeneca In order to be extra cautious, since although the risk of a blood clot is rare, it is very serious, and we have a very robust vaccine safety monitoring system in Canada. So side effects were tracked and that decision was made. So that said, people who were vaccinated with their first dose of AstraZeneca did the right thing to protect themselves and their loved ones. And the province and the government and Ottawa Public Health maintains that it was the right decision to make at the time, given the current situation. So we're now vaccinating with Moderna and Pfizer in Ottawa. And for people who were vaccinated with their first dose of AstraZeneca, they may be wondering if that means that they're going to get AstraZeneca for their second dose and what that looks like. So right now, Canada is looking at clinical trials in Europe to see if it's possible to give a different vaccine, like an mRNA vaccine, for example, instead of AstraZeneca for someone's second dose. So this is one option that's being looked into. However, the risk of a blood clot with a second dose of AstraZeneca is much, much lower than the first. So from the data we have now, the risk seems to be about 1 in 1 million. So much lower, but definitely the decision on which vaccine people will receive for their second dose, if they've had AstraZeneca for their first, will be based on, you know, making the best and most safe decision for everyone's health and well-being. So we'll update you with more information on the second dose of AstraZeneca as soon as we know more, and you can register again for our newsletter, check out our web pages, check out social media, etc., to get those details. Now, the variants of concern. Many people have asked if the vaccines are effective against the variants, and the short answer is yes. So research is ongoing, but the current vaccines that we have now are effective, or at least partially effective, against the variants. So the vaccines are still a very good line of defense against the variants. And vaccine makers are looking into how vaccines can be changed to keep them effective against new variants. This doesn't necessarily mean that you'll need an annual COVID-19 vaccine like with the flu shot. We still need a bit more research. Maybe we'll need a booster, maybe not, to be determined. The bottom line is that even though the variants are becoming more and more prevalent, I think they're like 95% of all COVID cases are variant cases now in Ontario. It's still important to get vaccinated because the vaccine is at least partially effective against the variant. So it's still our best line of defense for the time being. All right, so now we'll switch gears a little bit more, and we'll talk about what you can do as an employer and how you can encourage your employees to get vaccinated. So many employees actually rely, and you probably have seen this from your firsthand experience, that many of your staff rely on you and on the workplace to get their COVID-19 news. This might be more likely in maybe smaller enterprises, but definitely could also be the case in larger enterprises. And you have a really important role to play, seeing as that's the case and your employees turn to you for information. You're in a really good place because there's already a relationship of trust established between you and your employees. So it's important to share evidence-based information with them, and you want to share that in a non-biased way. So your job is not to tell someone whether they should or shouldn't get vaccinated. You can encourage them to get vaccinated by sharing the latest information with them, but you're probably not going to be successful at convincing someone one way or the other. And we'll talk on the next slide about exactly how you can have those conversations to just nudge people towards the direction of wanting to get vaccinated for themselves. So some reasons why you should be promoting and encouraging vaccines at work is that this can really benefit you as a workplace and as an employer by reducing employee absences due to illness So people aren't going to be going off on leave because they've gotten sick, severely sick with COVID-19, and is also going to help ensure sustained workplace productivity. It's keeping the workforce healthy by preventing people from getting COVID-19, and it's going to boost the workplace morale. And of course, the most important one here is possibly giving you the ability to slowly start looking at reopening your workplace and what that looks like and getting staff back at work. So how exactly can you support employees to get vaccinated? So talk about what you learned today with your friends and your family. Talk about what you're reading in newsletters and you know, from those evidence-based sources like OPH and the Government of Ontario and PHAC, etc. If you've had your vaccine yourself, share your experience with the people around you, with your employees. It's going to help them know what to expect, and it's going to help them see that, okay, this person that I know and that I trust has been vaccinated, and they look fine. They look the same as they looked yesterday. So that must mean that the vaccine can also work well for me. So it gives people a bit of a personal connection to the experience. You could also look at giving employees time off to get vaccinated. And if giving them time off is not possible, then you could look at staggering shifts in order to accommodate vaccine appointments. So employees generally book their vaccines at least 1 to 2 or more days before their appointment, and then they could communicate that to you and you could work around the shifts. In terms of giving employees time off, you could look at giving them a 3-hour block in order to get to and from their vaccine appointment. That would be perfect. And you could talk about vaccines at work. And then the last 2 bullets there, point 5 and 6, sort of go together. So don't belittle or shame people for having questions or concerns about vaccines. Show compassion and empathy. So for example, if someone says that they don't plan on getting the vaccine, just get curious about it. Why are they saying that they won't get the vaccine? Everyone has their own personal beliefs, and it's important to validate their feelings. So validating someone's feelings of being opposed to vaccination at that time doesn't mean that you're agreeing with them, doesn't mean that you're supporting them. It's just about listening to what they're telling you and acknowledging it. And that can often make someone feel heard and seen, and it helps build some trust in the relationship. So you can ask them the question, what makes you hesitant? Instead of why are you hesitant? So this shows curiosity about the person's position without making the person feel attacked. And by showing curiosity, you're giving them a safe space to share how they really feel. This also helps build trust. And this is really important to lay the foundation of trust, because then when you do share some vaccine information with them, they're more likely to listen to what you're saying. So remember, like, it's not your job to convince people to get vaccinated. Your job is to share the information and to nudge people towards vaccination. But they really do need to want to do it for themselves. They need to believe themselves that it's a good idea, as opposed to feeling forced into the decision. So what to say when people ask, why should I get vaccinated? So the sooner we can get Ottawa vaccinated, the sooner we can get back to normal. And this really is true. And as more people get vaccinated, more businesses are going to be able to reopen. Some public health measures are going to be reduced, and we'll be able to engage in more activities with people outside of our households. So this is really important from a business perspective, which means, you know, people are going to be able to go out, people are going to potentially be able to go into stores. And from a personal perspective as well, it means that you're going to be able to see your friends and to see your family safely. So it's that's a really good argument. And also, people are protecting themselves from severe illness and death from COVID-19. And they're helping protect the community as well by reducing the strain on the healthcare system. So with the impact of COVID, a lot of important surgeries have been postponed. A lot of medical procedures have been postponed. And this is having a really big impact on the community. So that's one argument, is the, do it for the people argument. And then the other one is do it for yourself, because you never know how COVID-19 can affect you. We see in the news every now and again, young people like 20-year-olds, 30-year-olds passing away from a COVID-19 infection. And I think it's easy as a young person to think it's not going to happen to me, but it definitely can, and it does happen. So, that's one really great argument that you could share with people. So in terms of what happens next, this is, good news for businesses and workplaces. The Public Health Agency of Canada just recently released these guidelines of what we can expect for the post-vaccine world in Canada. So for the summer, the goal that they've established is for 75% of eligible people to get have their first dose of their vaccine, and then for 20% of people to have a second dose of vaccine. Once we've reached that goal, then restrictions can start to lift based on the conditions in your specific public health jurisdiction area. So that means that we can look forward to small outdoor gatherings with family and friends, potentially gathering on patios, going on picnics, hiking, camping, these really great things that define summer for many of us. So that's exciting, and that's a really big motivator for people to get their vaccine appointments. In the fall, things are, the government's anticipating that things are going to be able to open up even further, with the goal of having 75% of eligible people fully vaccinated with their first and second dose. But this doesn't mean that COVID's gone, so we're still going to have some public health measures in place, but it should open things back up a little bit more, and give us all a little bit of a sense of normalcy that we're looking for. Overall, we don't yet know what the Ontario plans are for business reopening after the stay-at-home order, and what that will look like, but we will definitely keep you posted as those announcements are made in our community operations newsletter. Okay, so returning to work after vaccination, we'll switch gears a little bit more here, and we'll talk about side effects of the vaccine and how to fill in the workplace screening form when people are going to work post-vaccination. So this pretty graphic here, this pyramid shows the side effects and risks associated with vaccines. So the green and yellow are very common, and uncommon side effects. So the very common and common happen in 1% to more than 10% of people. So just based on everyone that I have in my circle who has had their vaccine, I think every person has told me that their arm was a little bit sore, it was a little bit of swelling. So I think that's pretty much expected. Some people may have headaches, they may experience fatigue, muscle or joint pain, fever, or chills. And then uncommon symptoms include, this is about less than 1% of people. This includes excessive sweating, itchy skin, rash or hives, muscle weakness, arm or leg pain, feeling weak, tired, or dizzy, abdominal pain, feeling unwell, and enlarged lymph nodes. And these very common and uncommon side effects shouldn't last more than 1 to 2 days. And you may feel unwell, but you shouldn't, if you feel like things are not right, then definitely check in to a medical professional, but they shouldn't last for more than 1 day. And then in the rare and very rare category, there's the potential for a severe allergic reaction. And that is mitigated by asking people to stay for at least 15 minutes at the clinic after getting their vaccine. And very rarely people experience blood clots, but that is only the case with AstraZeneca and Janssen, which we're not currently offering in Ottawa. So returning to work post-vaccine. Some, like I mentioned, some side effects are very common. Almost everyone will experience them. So you'll fill in the workplace screening form a little bit differently in the first 48 hours after someone has had their vaccine. You still want to do the workplace screening form every day before the start of every shift. So that's really important. Even if someone has been vaccinated, you still want to continue doing it. Employees can come to work after getting their vaccine, even if they screen positive for the following symptoms within 48 hours after getting their vaccine. So, headache, fatigue, muscle ache, or joint pain. If an employee experiences any of these symptoms and the symptoms are mild, they only began after getting their vaccine, and the employee feels well enough to work, then they can attend work or they can continue with their shift. There are some reasons to not go to work. So if the symptoms worsen or if they last more than 48 hours, then the employee should go home and seek testing if necessary. If the symptoms are interfering with their ability to carry out their usual activities, again, go home, get tested if necessary. If they have any other symptoms of COVID-19 that cannot be attributed to the vaccine, so respiratory symptoms, loss of smell or taste at any time after vaccination, again, go home. And if they've come in close contact with a COVID positive person in the last 14 days. After people have their vaccine, the immunity is not immediate. So it does take about 2 to 3 weeks for people to have built up the sufficient antibodies. And in addition to that, you do still need 2 vaccines for maximum immunity. So there's still a risk that someone could be getting COVID-19 after having had their vaccine. And that's why it's important to continue with the screening and to continue with the public health measures. So next up, I see a lot of questions are coming through the chat, but I'll first hand it over to my colleague, Jen Maybank, and Jennifer is going to take you through our workplace vaccine toolkit. I'll stop sharing my screen so that she can share hers.
Hello, thanks Chantal. So I did want to introduce 2 new resources that we have for employers on the OPH website. And I think these resources really complement the content of today's presentation. So I know you'll have access to a recording of this presentation, but if you're looking for something in writing to support what you've heard today, these might be good resources for you to check out. So the first that you can see on the screen here is the new COVID-19 vaccine toolkit for employers. So you can find this page at ottawapublichealth.ca/workplace vaccine toolkit. But if you're familiar with our businesses and workplaces webpage, if you've been visiting that throughout the last year, you'll find a nice box on the right-hand side of that webpage that'll link you to this as well. So this toolkit is intended to assist businesses in building confidence in COVID-19 vaccines, to increase uptake among employers and employees, and in establishing supportive policies and best practices in the workplace. It's also a one-stop shop if you're just looking for links out to other Ottawa Public Health resources and provincial vaccine resources. I know there's a lot of web pages and links to navigate, so hopefully you'll be able to find what you need on this page, or at least somewhere to get started. It also outlines suggestions of how you as employers can support vaccination efforts. So you can see here in our How Can Employers Support Vaccination Efforts section, a lot of this information echoes what Chantal has shared today. So if you're looking for a bullet form version of that, you can find that there, as well as links out to some resources that'll support you in having those conversations. We, of course, really want to encourage you, as Chantal mentioned, to have these conversations with your employees. As she said, it's not your job to convince anyone to get vaccinated, but people are looking for resources they trust on vaccines, and often their employers are someone they trust. So it's a great opportunity for you to share that information. So we have two things on this webpage that I think are particularly helpful there. The first is some sample messages to employees. So if you have your own workplace newsletter, if you have your own social media channels, either internal or external, and you want to share some information about vaccines to your employees or to your general audience, we have some sample messages here that you can start with. And we also have some links to some graphics, which I'll show you in just a moment, but if you want to spruce things up, make them a little more colorful, we certainly have that for you as well. We also have, and I know it's been shared in the chat already, the link to our community operations newsletter if you aren't subscribed already. The city's vaccine newsletter is a great source of information, and we also try to collate that once a week into our community operations newsletter to try to keep you up to date as much as we can on these rapid changes to the vaccine rollout from the province, as we saw this week with the change to 18+. And as you can see, there's also a list of additional resources here for you as well. The other resource that I wanted to share, which you may have seen through the city's social media channels or through OPH's social media channels, is the new community immunity page. So this is really a resource to help promote vaccine confidence in our communities. And you can find this at ottawapublichealth.ca/community immunity. But there are two particular resources here that I wanted to highlight. And the first is the How to Talk Vaccines resource. So this is a really great complement for what Chantal shared earlier, and is a PDF poster. So if you are looking for something that you can print out and have as a resource for you at work or in your personal life as well, this gives some great tips on how to talk vaccines. We also encourage you to share your own experience getting vaccinated. Seeing our friends, colleagues, and family being vaccinated can help address hesitancy. So if you've been vaccinated and you want to add our new photo frame to your Facebook profile, kind of celebrate that and share your experience, you can find the information on how to do that there. And then we also have some of these fantastic graphics. So if you are looking for some graphics to add to your newsletter or to your social media messaging encouraging vaccination, you can download these very easily from this webpage as well. So I think we will move to the next slide. Let's see if I can get that up on the screen. So of course, we really appreciate everyone's attention today. I know it's sometimes a lot to fit into your schedule to take the time to attend a presentation like this. So we will be sure to put a link to our vaccine newsletter, as well as the link to our business and workplaces newsletter, the community operations newsletter, in the chat box. And we definitely encourage you to register for that to get the latest information. And I think now I'll hand it back to the moderators for a question and answer period.
Excellent. Thank you, Chantal and Jennifer, so much for all of this wonderful information. So we're going to go right into the questions that have been posted in the chat. The first question is regarding staff who have expressed concern over virus shedding to others, and what are your thoughts on that? Chantal, would you like to take that?
Yeah, thank you, Lynn. This is a new topic that we've been hearing from the community, so it's always great to hear what people are asking so that we can find answers and share those publicly. So the concern over virus shedding, it's not applicable in the case of the COVID-19 vaccine. So viral shedding can only happen after someone gets infected with a live virus. And in the case of COVID-19 vaccine, it is not a live virus. So, you know, it works with the spike protein. It initiates an immune response in the body that will then, you know, our little, we'll call them fighter cells, will have a memory of how to combat the live virus if they do come into contact with it. But it's not a live virus that you're being vaccinated with, so there's no chance for you to give the virus to other people.
Awesome. Thank you, Chantal. Our next question is, are there specific research documents regarding this DNA alteration falsehood that could be shared as a resource for others?
I can look and see if there's a specific document. Like on our webpage, we have an FAQ, and here I can put that FAQ in the chat right now. Just copy paste the link here. So there you can see our Ottawa Public Health position on it. You can just send people to that. I can see if I can find something from a different source. But yeah, this answer here is based on, you know, on the research that we have that's available out there. So the answer is no, and I'll try to find a different source if you guys want something that's a bit more like an infographic, something a little bit more pretty, we'll say, for people to be more engaged with.
Thank you, Chantal. Next question would go to Chantal or her colleague Crystal from Ottawa Public Health. When can those who receive the first dose of AstraZeneca expect to be able to book their second dose in Ottawa? And will Ottawa ensure that those who receive their first vaccine dose will receive the second within the required time period?
Yeah, I touched on this in the presentation a little bit. So like definitely everything will be done to ensure that that 4-month interval, recommended interval between first and second dose is respected, since that is the recommendation from the National Advisory Committee on Immunization. And in terms of, you know, the second dose for people who got AstraZeneca for their first, there is still some time to go before the 4-month period will be up for those who received AstraZeneca for their first. So we're still waiting on the results of those UK clinical trials in order to then make the decision of whether people can get a different vaccine for their second dose or if they should all get AstraZeneca for their second dose. But you know, the time frame that's recommended by the NACI, everything will be done to respect that 4-month interval, and people can sign up to our newsletters to get the latest information on second doses.
Thank you, Chantal. I think the next question will go to Crystal. What are the chances that OPH will begin deploying mobile vaccine clinics?
Yeah, hello. I don't know what the chances are, but what I can share right now is that we're directing all people to the mass community clinics, and then, excuse me, still considering some options likely in June for those people that are still having a lot of barriers to accessing vaccine. Then we'll look at some other strategies. So we did have some neighborhood pop-up clinics. We have had interest from some workplaces. We haven't confirmed any of those as options right now that we are pursuing. So not sure what the chances are, still seeing what some of the options will be if there are still really a lot of barriers for some people.
Thank you, Crystal. Next question, I think will go to Chantal. How can businesses comply with the post promise if employees won't get vaccinated? How do they protect their customers and other workers? And can shifts be cut for those who won't get vaccinated?
I think that's a bit of a legal question that I don't have the answer to, unfortunately. I don't know if there is an answer out there of, you know, what employers and businesses can do if an employee does not get vaccinated. I think that's still something that's, you know, perhaps being looked into at a higher level, but it's definitely not something that Ottawa Public Health is in a position to give guidance on, since it is a legal question. I think what we can say is that your role as an employer is just to encourage people to share the information. And, you know, we will reach a point as well where we have achieved herd immunity. from the latest information that I'm seeing, it will take some time. So in the meantime, maintaining those public health measures and encouraging everyone to make their appointment as soon as they're eligible, that's all we can do for now.
Thank you, Chantal.
And Crystal can add something as well.
Yeah, can I just add, and thanks, Michelle, I see in the chat that you added a link, and Lynn, to that in the Ottawa Business Journal, and it's a question we're getting often. It's outside of the scope of public health. It really is a legal issue, but that it's overall employers can't mandate vaccines due to human rights reasons and privacy reasons. I look forward to checking out that link a little bit more, because I have been looking for a link that has all of this summarized. But I guess that's the short answer. And I'm anticipating we will see more of this over the coming months, but it's certainly more of a legal space.
Thank you, Crystal. Eamon Harden is actually one of Ottawa Board of Trade's members, so I'll see if I can get some slides or something that can be distributed to our guests today. The next question, I think we'll go to Crystal. And the question is, where does retail fit in here? And this question was posted when we were looking at spring, summer, and fall scenarios. So this is in regards to reopening.
Yeah, so that image that was shown was from the Public Health Agency of Canada, and really what they're seeing on like plans for a population health approach for reopening, if you will. I think where retail will be reflected is when we see what comes from the Ontario reopening framework. So all of you will be very familiar with what we've had as the provincial reopening framework, with the different colors and had different targets and what could and couldn't be open and restrictions in place. We don't know what the reopening framework will look like at the end of this stay-at-home order. We anticipate there might be some changes, but I don't know what that will be at this time. So I don't know that retail, you're not going to see that in a Public Health Agency of Canada document likely, but you will see that in the provincial reopening framework that I'm expecting will be adapted.
Yes, it's often a surprise, isn't it? Thank you, Crystal. Next question. Does the spring, summer, and fall schedule apply for people with children? And this question, maybe Crystal, you can take a stab at this one.
Sure. And again, I don't have a clear answer. And I'm guessing this question's there's been other guidance about for families throughout the year, right? There's been different guidance about families, or strict to your classroom cohort, to your daycare cohort. And I'm not sure how that's going to be modified. As you heard earlier, that vaccine will be eligible for those individuals 12 and older. We expect in June. So that will start opening up vaccination for many children, but right now there's no vaccines approved for children younger. I don't know that the measures will change. I think the thinking, like with schools, is when community transmission is lower, and we hope that as more adults are vaccinated, community transmission is lower, that has impacts on what measures are in place for children and for families. So again, I don't have a clear answer, but I think we can anticipate as greater percentage of the population is vaccinated, we will see public health measures be reduced in different settings and for different population groups.
Crystal, the next question comes from a local business that is already doing on-site rapid antigen screening, and they want to know, will this need to continue once the majority of their staff have been vaccinated?
I can take that one, Chantal. I think with rapid antigen testing, it's one other public health measure. Like, that's on top of maintaining distance, having masks, doing your screening. It's one of those other measures. So as more people are vaccinated, that some of these measures can be reduced. And not to speak for the program that you're bringing in, Board of Trade, but I think there's kind of a timeline on that program potentially about when it's going to be most effective, is when we we don't have as many people vaccinated, and that when you do have a higher percentage of the population vaccinated, that is likely one public health measure that can be reduced.
At the moment, the rapid antigen distribution is anticipated to go until the end of August. So covering all of our bases, layering up all those different options for protecting our workforce and people's health and businesses. So definitely until the end of August, just in case people are wondering. Our next question is again with the rapid testing. What background or skills do you need to administer the rapid test?
I'm going to defer you to our website. I don't have it at the top of my fingertips, and we can put it in the chat if one of my team members has it handy, our rapid testing webpage. But it says what's required of workplaces, and soon we'll be more information from your organization as well for some eligible organizations.
Absolutely. Thank you, Crystal. Yes, we'll talk about that in tomorrow's info session. We did post the link at the top of the hour in the chat, and we'll send that out if people want to drop by and hear more about this program. Next question can go to Crystal or Jen. Would it be possible to make a sign for retail outlets encouraging customers to get vaccinated?
My first question, Jen, do you know within our community immunity campaign if something exists that could be used?
I know that we're working on developing.
You're just cutting out, Jen.
Can you hear me? Perfect. Okay, I know that we're working on developing some posters to go with the community immunity campaign. I think those were mostly focused on the actual vaccination clinics, but I can absolutely follow up with the communications team to see if there is a template that could be shared with businesses.
Jen, next question, and I think this will go to Chantal. Are there guidelines for measures if an employee won't get vaccinated or don't want to disclose whether they were vaccinated or not?
Again, I think that would fall under like the legal piece of, it's not something that's within our public health scope. So maybe stay tuned to the Ministry of Training and Labor. I'm botching the name right now, but it's not direction that will come out of Ottawa Public Health.
I suspect the lawyers' phones are going to be ringing shortly. Yeah, next question I think goes back to Chantal again. Is there going to be a vaccine passport?
That's a good question. It's something that I think they're doing here and there in the US, where some people who are fully vaccinated and can show proof of it are able to do certain things. And we don't currently have plans to do that here in Ottawa. I haven't heard any whispers about doing that here in Ontario either. But stay tuned, and we'll share information on that when we know more.
Yeah, I can just add the federal government was considering options right now. I don't have any details of it, but that has been in the media regarding more of a federal jurisdiction.
Mm-hmm.
Crystal. Next question. What is the risk of catching COVID-19 and passing it on to others after you've been vaccinated with your first dose?
Yeah, I can take that one. And I'd actually like to share my screen again. I'm just going to get back to the right page here. We have this. This is our ottawapublichealth.ca/COVID-19 vaccine webpage. So this is where you get all the information on, eligibility, where the clinics are, second dose information, pop-up clinics, all of this information is here. And then if you scroll down a little bit lower, we have this table. And this doesn't directly answer the question because I don't have the direct answer to the question. That's still data it's a gap in the available information. but we do have this information here. So it shows you at the very far end of the table where I'm highlighting. So you can see how effective the vaccines are against symptomatic illness. And then this is after 2 doses, for the record, the first one. And then number 2 shows effectiveness against hospitalization and death after just 1 dose. So, you know, you are very well protected after 1 dose from hospitalization and death. And from symptomatic illness after 2 doses, you know, you're still very well protected depending, well, you're very well protected with all vaccines. And it's not really an apple-to-apple comparison either, because at the time of clinical trials, you know, Pfizer and Moderna were trialed before the variants became so much more widespread and prevalent. So you see that they're a little bit more effective, but who knows if they would have been the same results in a different scenario. But yeah, this shows you that they're very effective against symptomatic illness and hospitalization and death. And yes, you can still transmit the virus even if you are fully vaccinated yourself. Like, we have seen cases in Canada and around the world, people who are fully vaccinated can still test positive for COVID-19. They may be completely asymptomatic, however. So just something to keep in mind, which is why it's so important to maintain our public health measures until we can get more people vaccinated, because we don't want people to have symptomatic illness, because that could lead to, you know, severe outcomes.
Thank you, Chantal. We've just come to 12:03. We have 3 more questions that have already been posted in the chat, so we'll do our best to answer those ones. And then any further questions that you have, you can email them to me at strongertogether@ottawabot.ca, and I'll make sure to pass them along to Ottawa Public Health. So the first of our remaining questions is, how will people who got the AstraZeneca for their first dose be informed about when they can get their second dose?
So register for a newsletter. We'll share it there. We'll definitely be sharing it there as we know more. You can always check our vaccine webpage that I just brought you to. The information will be there as well under the Booking Your Second Dose tab. And I think, like we've seen with the vaccine rollout so far, the information is shared, I'd say, like from what I can see anyways, I feel like it's shared through so many different channels. Like, we share it on social media, we share it on traditional media, we share it on the news. So by tuning into any of those channels, you will probably hear the update, and it's, you know, we'll give people a heads up. It's not going to be the day of that those appointments are available. We won't be sharing the news right then and there. We'll be giving people as much of a heads up as we can.
Great.
I'll
Thank
add
you,
to
Chantal.
that. Can I add to that one
Sorry,
as
Crystal.
well? That's okay, just because all of the AstraZeneca that would have been offered in Ottawa would have been through pharmacy or primary care clinics to date. So each of those individual pharmacies would be required to call back in individuals for their second dose, and same with primary care. So probably for the AstraZeneca, we will have information, but that should be, because it was that different channel of access for that vaccine versus the mass clinics, that it should be a more targeted correspondence with those individuals.
Oh, that's great news to hear, Crystal. Thank you, because I got the AZ dose myself, so I'm looking forward to getting my number 2. Okay, second last question. Can testing be mandated versus vaccination mandated? You want to try that one, Chantal?
Yeah, again, I don't really have an answer for it. At the time, you know, testing and vaccination are not mandated. It's just something that we're encouraging people to do. But, you know, there are rules around getting tested. Like, if you are symptomatic, you know, you're not going to have a police officer knocking on your door, taking you by hand to the testing center, but you are asked to do that, and you are asked to self-isolate. People are asked to get vaccinated. So we're really asking people to just, you know, make the best decision for themselves and for the whole community. And
I'll add to that as well, specific to rapid testing, that many workplaces can have that as their individual policy. So I guess in an effect may mandate that for that workplace policy. So that I guess that is a piece that can be considered. Otherwise, broader testing, as Chantal said, is not mandated, but the isolation, if experiencing symptoms, is mandated within our section. We have a section 22 class order in place if you are experiencing any symptoms required to isolate.
And Crystal, I'm going to throw the last question back over to you as well. Is the rapid antigen testing effective on people who have received the vaccine?
Oh, you're giving me the tough ones today.
Sorry. Blame Kyle.
The short answer is yes, but I need to look up the mechanism of how both of those work to be able to explain it. But the way that the rapid antigen test works is to pick up on that antigen, that molecule that you would have if you had COVID. I don't know, and I can follow up, if there is like a time period after vaccination that it might skew rapid testing. That I would need to follow up on. But after a certain period, that it should still be effective. So I will take that one away.
Great, thank you, Crystal. So we're past our allotted hour for today. We're at 12:07, so to be respectful for everyone's times, we will wrap it up now. There is an evaluation survey that's been posted in the chat. I would love for you to click on that link and answer a few quick questions about today's session. Thank you all so much for your interest in learning more about vaccines and how important they can be to protect your workforce and your workplace. It's just one extra added layer of protection that will help us bring an end to COVID, hopefully sooner rather than later. But the more different steps that we take, the more safely we operate, and that includes, as Suling said at the top of the day, have your staff, encourage your staff to get vaccinated, use the PPEs, make sure you're maintaining physical distancing, keep non-essential workers out of the workplace until they're vaccinated. All of these things are going to help our economy recover, and so I congratulate you all on being interested and checking out all of the information and getting it from the right people rather than on social media or online. And just a reminder that we will send out a recording a link to today's recording. It'll probably take 24 or as long as 48 hours to get it up and ready. And we've had some requests for today's slides, so we'll send those out for you as well. And all of the resource links that were posted in the chat, you'll receive those too. So on that note, thank you so much, everybody. Thank you very much, Ottawa Public Health, for once again offering accurate and timely information and transparent information. You know that they're being honest and truthful when they say, I don't know the answer to that. So that's outstanding. So have a lovely afternoon. Enjoy this beautiful summer-like afternoon and have a great day. Thank you.